sudden numbness or weakness, problems with balance or coordination, problems speaking or understanding speech, problems with your vision or gaze, sudden confusion. What are those symptoms of? Well, if you said stroke, you're right. Now, those aren't the only symptoms of stroke. There are others, but I think it's important to understand what the symptoms of stroke can be. First thing I need to say, guys, is if you experience these symptoms at all, you need to go to the emergency room, seek emergency care right away. A stroke is a medical emergency. Now, why are we even talking about stroke today, you ask? Well, you probably have heard on the news that there have been some patients with coronavirus that have also had strokes or stroke-like symptoms. That's right. It's something that we've been hearing more and more about. And in particular, many of these patients have been patients that are young, patients less than 50 years old, patients with very few, if any, underlying medical conditions that have been diagnosed with COVID, but have also had stroke symptoms, this numbness or weakness that we're talking about, the problems talking, the problems with the gaze, or problems with consciousness or confusion. Guys, I understand and I know that this is very scary, but it's really important for us to talk about. We know that the signs and symptoms and conditions associated with COVID-19 are changing, or rather we are learning more and more every single day. It's important for you and me to understand that symptoms of stroke have been associated with COVID-19. Now, some of the take-homes here are, number one, to understand what these signs and symptoms of stroke are. We often say time is brain. That literally means what it sounds like. If you are experiencing, or a loved one, stroke-like symptoms, or you think you might have stroke-like symptoms, or even if you're not sure, you need to be seeking emergency medical care right away. I know we are in the middle of a COVID pandemic, and that has kept a number of people away from the ERs, saying, well, I don't want to get further sick. I don't want to go to the ER. But that is not the right way to think. If you have an emergency of any kind, whether it's chest pain, shortness of breath, stroke-like symptoms, whatever it is, I don't care, or trauma, okay? You've broken a bone or what, you've fallen. You've got to go to the ER, even though we are in the midst of a COVID pandemic. That is so important because delaying emergency care could literally be putting your life at risk. Now, you probably are saying, well, why are these strokes happening in these young people with COVID? Well, we don't exactly know. It might be a combination of, an inflammatory response in the body, or the inflammation that's happening in the body, how our body is responding to all of this. It could be any of that and more. We are just now learning and trying to understand what's happening in the body. So hopefully more to come about that. But what we should focus on right now is educating ourselves about the potential symptoms, understanding what's an emergency and what you need to absolutely go to the ER for, and also focusing on things that we know we can do to keep ourselves and our families safe. That is wearing a face mask when we go out. That is only going out if we need to. That social distancing is very, very important. If you are out and about, staying 6 feet away from other people, making sure that you're washing your hands, using hand sanitizer, not touching our face, wearing our face mask, as I mentioned, guys, all of that's very, very important. Remember, I will keep you updated as best I can. I'm Dr. Jen Caudle. Stay safe, and I will see you soon.